7 things your pee is trying to tell you about your health. As strange as it may sound, every time you use the bathroom, you get the chance to look at your health. No, we're not talking about weighing yourself or looking for pimples on your face. We're talking about going number 1. Yes, you heard correctly, folks. You can tell if your body is healthy or if you need to see a doctor by looking at the color of your urine. We'll walk you through the 7 signs that your pee can give you about health, particularly about the many colors you might notice and what they may say. On top of that, we'll offer you a few suggestions about how to approach each issue. Stay tuned till the end, so you won't miss any of the warning signals and can be prepared in case you or someone you know experiences this.
This is Metamorphic Tenets.
7 things your pee is trying to tell you about your health. Starting from number 7, orange pee. Don't worry just yet if you discover that your urine's color has unexpectedly become orange. It turns out that various anti-inflammatory medications, chemotherapy, and laxatives, including senna, can result in such a hue shift. On the other hand, the cause can be more straightforward. Are you perhaps eating too many carrots? This is no joke. Beta-carotene, a carrot pigment, can cause your urine to turn orange. Try consuming extra water if you're certain none of the situations mentioned above apply to you. Your extremely concentrated pee may be a sign of dehydration. The hue here might range from orange to dark yellow, and should return to normal in a few hours if you drink more water. Along with orange urine, the appearance of any yellowish tint in the whites of your eyes may indicate that your liver isn't working properly. There is nothing you can do on your own in this situation, so schedule an appointment with the doctor right away. Number 6, green or blue pee. Certainly the most stunning amongst them all is seeing these colors in your pee, because they seem the furthest from natural. Remember, consuming foods like artificially dyed foods or asparagus can cause the urine to become so discolored that it is blue or green. There's no cause for concern if this is the reason, because within a day or two it will clean up. Drugs like amitriptyline, indomethacin, and propofol can also generate similar kinds of hues. However, if none of these explanations seem true, you need to call the doctor immediately. Forget setting an appointment. Calling 911 would be so much wiser. Green urine may indicate a rare urinary tract infection caused by the Pseudomonas bacteria. This insect can also create kidney stones, which we all know can be uncomfortable when they try to pass through the urinary canal and leave the body. Number 5, pink and reddish pee. The majority of people typically panic when they see pink or reddish pee, but it's not necessarily something to freak out about right away. Certain meals or medications are likely to blame. If you recently consumed beets, blackberries, or rhubarb, then you most likely don't need to worry. After the kidneys perform their job, some of the substances that give these foods their red color are eliminated into your urine. Your urine should return to its usual color by the next day if these foods are to blame. If it doesn't clear up, however, make a doctor's appointment. Another explanation might be the consumption of some antibiotics such as Rifidin and Romactane that are used to treat tuberculosis, which can make urine somewhat reddish. Your urine may also appear pink if you're using a medication like phenazopyridine to treat urinary infections. Always keep in mind that you should only use prescribed medication, including antibiotics. You should also receive a side effect warning from your doctor. Make sure to ask if they don't say anything. If you're enjoying this video so far, please support us by hitting the subscribe button and liking the video. By doing this, you are helping us reach more people to share this amazing information with. If you have a topic that you want us to talk about, let us know in the comments. We are looking forward to sharing more amazing content with you in the future. Now that that's out of the way, let's get back to the video. Furthermore, blood in the urine is another factor that can cause the urine to become pink or reddish. Blood in the urine may indicate kidney disease, cancerous or benign tumors, kidney or bladder stones, urinary tract infections, or other conditions. Do not hesitate to see your doctor if you notice any blood clots or other tissues in your urine. According to doctors, these symptoms are underdiagnosed, particularly in women, because they are typically dismissed as weird period flukes. Number 4, foaming or fizzy pee. It's typical to experience foamy urine occasionally. It's mainly foamy because of the speed of release. You know, like when you've been holding it in for a very long time on that long trip, just hoping for a pit stop. Don't worry though if it foams up after you just sprayed that substance out of you like a jet sprayer. But if it keeps happening and you start seeing it more frequently over time, then you might want to call the doctor. Urine that is foamy or bubbly may also indicate an overabundance of protein. You should have a medical professional evaluate this because you could have a significant kidney issue. We just want you to be safe and healthy. We're not trying to frighten you, okay, guys? Number 3, brown pee. The presence of brown hues in your urine may indicate severe dehydration, so give up the coffee and start drinking more water instead. By the way, you can watch our video about 16 signs that you aren't drinking enough water. Also consider whether you recently consumed any rhubarb or fava beans as well. Contact your doctor if the hue persists after you've excluded these foods and are confident that you're drinking plenty of water. Your liver and kidneys may be having issues if your urine is brown. Pay close attention. There's a good chance you have a genetic disorder if you also have seizures, rashes, and brown urine. Additionally, with blood clots, it takes on a brownish tint, which can indicate a tumor or a more serious condition. As you can see, speaking with a specialist is the best course of action, regardless of the potential cause. Don't waste time wishing it would disappear. Number 2, transparent pee. If your urine is clear, then you are drinking too much water. Yes, having too much is just as bad as having too little. You must get it just right, like Goldilocks. Consuming too much water carries certain risks, the most significant of which is the dilution of body salts. This may result in a dangerous chemical imbalance, so cut back on your water intake for a while and see if your urine truly is transparent for that reason. And lastly, number 1, a pale straw color pee. Dark yellow, yellow, or transparent yellow are some hues that you should be comfortable seeing and about which you shouldn't be worried. Your urine should ideally be a light yellow color. The presence of correctly colored urine indicates that you are neither dehydrated nor overhydrated. You only consume the necessary amount of water. Great job. If your urine is more concentrated and doesn't appear to be pale gold, then you need a little more water. One golden rule to keep in mind is that if it looks like lemonade, you're doing good. Quick question. Do you guys pay attention to the color of your urine, or do you find it awkward to check it? Tell us in the comments below. Share this video with your friends and family. You never know, they might be observing some of these colors while being completely clueless as to what to do. For weekly freebies and contest giveaways, make sure you follow the link in the description to Metamorphic Health Weekly, where we send out a wide range of health tips, free recipes, fitness tips, and contest giveaways. Be sure not to miss out. Click the link below for Metamorphic Health Weekly. We hope you enjoyed today's video and would gladly appreciate it if you gave us a like and hit that subscribe button to help support the channel.